When it comes to COVID-19, those most at risk are often least likely to be vaccinated. According to new data from the Centers for Disease Control and Prevention, only 5.4% of Black Americans and 11.5% of Hispanic and Latino Americans received a COVID-19 vaccination in the first month of distribution. Here to talk about this trend and attempts to reverse it is Dr. Quinn Capers, a nationally recognized expert in diversity and inclusion in academic medical centers who recently joined the UT Southwestern faculty. Welcome, Dr. Capers. Historically, we've seen that certain populations or certain groups of people tend to be hesitant of vaccination. Why is that?
Communities of color, in particular now, I'm going to speak about African Americans. There's been a long history of mistreatment of the African American community by the healthcare system. It goes back 400 years, back to slavery times, and then to Jim Crow times, and then even to modern times, whether it's Tuskegee experiment or other examples of mistreatment of Black people by the healthcare system leads to some mistrust and this hesitancy that we see in communities of color, particularly Black communities.
What worry do you have about the long-term effects on communities of color from that vaccine hesitancy?
We know that Blacks, perhaps because of some of these social determinants of health, some of the social inequities and disparities that lead to more of these morbidities like high blood pressure, diabetes, obesity, that they're going to have a tougher time and a tougher course with COVID, a higher death rate, a higher rate of winding up in the intensive care unit in communities of color, especially if it's because we're hesitant to get this vaccine.
Understanding the importance of the COVID-19 vaccine, what's the right way to reach people who are hesitant? Who would they listen to and why?
I think the messenger is important. And I think communities of color need to see people who share their culture and their background and who live in their neighborhoods and their communities, people that they trust, whether it is the people they work with every day at the hospital, people in the neighborhood, or religious leaders in the churches can really help to get out this message. So as an African-American physician, I want people to know that I got the vaccine. And so I even had a photograph, a selfie of me getting both of the vaccines and put it on social media. I think that is what we need to do.
In terms of raising awareness about the vaccine, what messages would you suggest be sent?
There can be a misconception that the vaccine is actually injecting COVID-19 into you. So we can educate about that it's not it's not the virus. It's actually the blueprint. I like to say it's the blueprint for a part of my blazer, a blueprint of the coding of the virus, but it stimulates your body to produce these antibodies, but it's not injecting the germ of the virus in you. That's an important misconception. Many times when I hear about vaccine hesitancy with my patients with the flu vaccine, I've heard patients say, oh, I never had the flu until I took that flu shot. And they will say that they got the flu shot and for a day or two, they had a fever and they felt bad. And it's about educating them that, no, that wasn't the flu. That's just your body doing what it's supposed to do. So I think attacking misconceptions and myths as we educate will help us move the needle.
February is Heart Month. You're a cardiologist like I am. How are you thinking about the risk of heart disease and the concurrent risk of developing COVID-19 infections in communities that are at risk?
The best way to keep your heart healthy, other than seeing a regular doctor and knowing your numbers, is to be active, to be physically active, to be exercising 30 minutes a day, 5 to 7 days a week, getting your heart rate up. With COVID, we're all clustered in our homes. We're not going to the gym. Maybe we're not walking in the park like we used to. So I'm concerned that we're going to see a blip in heart disease once we're past the pandemic. I'm also concerned that people are staying at home with their chest discomfort and their cardiac symptoms because they're afraid to go to the doctor because they think they might catch COVID at the emergency room. So all of these are really important considerations and are things that we cardiologists think about a lot.
In our UT Southwestern community, we're seeing people employees and patients who didn't get it right away, who were sort of waiting to see how it went, perhaps hear from some friends or family members who were vaccinated and see how it went for them. And now they're thinking more formatively about being vaccinated. What would you say to people that are on the fence?
really is to get your information from a trusted source, not from your friends, from your neighbors, but go to a doctor or call us here at UT Southwestern, and we'll hook you up with somebody that can give you some good information.
So Dr. Capers, you've represented UT Southwestern at a lot of town halls and open discussions about the benefits of vaccination. Why is this important to you personally?
First of all, as a physician, I went into this business to help people. It's important to me because I feel like a part of my passion and mission in life is to do what I can to try to reduce or eliminate healthcare disparities. And it's important to me personally because I am a Black man. I'm a Black man with Black family members. And the fact that my community has a disproportionately high death rate from this COVID-19 disease is troubling to me, that that community would be the exact community that is hesitant to get the vaccine that can protect us.
Dr. Capers, if someone came to you today and said, should I have a COVID-19 vaccination, what would you say to them and why?
We've all been in the throes of this pandemic, praying for an answer. It's here. We have a safe vaccine that is effective. Please think hard about getting this vaccine.
Thank you again for joining us, Dr. Capers, and for these important insights. Until next time, stay safe and stay healthy.